And so I find it hard when people think that we should do nothing, we'll wait and see, and God will help us out. But no matter how difficult I find this in terms of the way I would think about my care, I need to think about this family and their value framework. And so it doesn't mean I should give up and say, okay, we'll wait for the miracle, because I also think I have something professionally to deliver. And a colleague of mine says, that's okay, you've got two people working for you now. You've got God and you've got me. And I can help with these things, and your religion and God can help with these things. And so you can't take religion out of someone's value system, but also you have a duty of healthcare to support them doing what you can do. And I always say to people, don't go up against God. No matter how brilliant I think our profession is, speech language pathology, it is the chosen profession. If God is saying something different to a family, then we're never going to trump that. So do what you can and support people and respect where they're at. Non-maleficence is to avoid doing deliberate harm to patients. And I'm pretty certain most speech language pathologists, if not all, would throw up their hands and say, oh, I would never deliberately harm my patient. That's dreadful. I really wouldn't do that. As would any other clinician. So we might do something if we were physical therapists or people who work in orthotics and prosthetics, making sure that our patients who have, say, a stroke get appropriate support to avoid things like contractures. We know that's coming down the line in certain conditions, so we should get in there and avoid harm coming down the line. But as I mentioned previously, we now have evidence that shows that thickening liquids and mushing up and pureeing people's diets causes them to take less. People get dehydrated and malnourished. And so if we blithely go in there and recommend an altered diet, with this evidence that's now out in the big wide world, we could be accused of being maleficent. We know that this action causes problems, and so we have to be very careful about that and conscious of these things. I'd like to think that this is an extreme example that people got this is personal bias and has no place in our professional interactions with patients. The ASHA Code of Ethics states clearly that we shouldn't let our, biases, we shouldn't interfere with treatment, we shouldn't let our, if we're not very well, if we're not up to the job competently, we need to know that and monitor it when it's appropriate for us to not work with someone, to ask for some help, to refer on. And this also covers your personal value system. If you have a value that means it's really inappropriate for you to work with this person, then you must refer on to someone else who is competent and who can work with the patient. We can't abandon patients. And what I'd like to encourage is that we need to take a cold, hard look at our own value systems and learn to put them in a box a bit. But there may be occasions where whatever it is about you and this patient, the clinical relationship is not going to go well. You need to recognise that and make sure that there's a place for this person to go to get appropriate treatment, which could be another speech language pathologist in your practice. It could be someone in a different practice. But you've got to recognise when things really aren't working.